Hey guys and gals, Ed Sharp here, your resident consultant for the Million Dollar Practice Club, which is sponsored by the Customer Factory. Give a shout out to those guys. Thank them for having this set up to help you. I'm here to help you with your practice. So I'm doing a three-part series here. The first part was on more new patients. That's part A of the ABCs of the 3 ways to expand your practice. Today we're going to talk about part B, and that is better retention. Part B, better retention. Now, as in the last video we talked about, well, if your patient visit average was too low, we used the example of 100 visits and 10 new ones just got coming in a week. So your patient visit average was 10. That's like a pain relief clinic. It should be much, 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 much higher than that, unless that's what you want, which is totally fine. But the amount of effort and work it takes to get a new patient into your office can be quite a bit sometimes. Ask those guys at the Customer Factory. They work their tail off for you to help get new patients in there. So anyway, the amount of work it takes to get them in there, if you want to expand your practice, and your patient visit average is not good, and remember you divide your new patients into patient visits, then and it's going to take a lot of new ones or a whole major marketing program to get in the level you need, then you need to look at your report of findings. That's the key. 99% of the time when I work with an office and they go, hey, I need more new ones, I go, well, first off, let's look at your report of findings. Because if we can fix that, if we can increase your patient visit average from 10 to 20, you just doubled your practice and you did no more marketing. And that's the easier way to do it. It's always easier to be able to sell your patient the care that they need. And that's the B part. That's the retention part. And that's critical. And there's 2 ways to see if your report of findings needs work. One is that your patient visit average is too low. And the other is that if you are offering prepaids for your services, are you getting them paid in full? And if you're not getting that, then there's definitely an issue there. So work on your report of findings. That's critical. Now, if you want to talk to me about it, I have one of my, one of my clients that called and said, hey, got some issues here. And he wasn't closing his patients. He had 7 in a row, he didn't close. And I said, okay, so what are you doing? And I gave him a few pointers in 3 different areas, and then he closed the next 4 out of 5. It was just boom, just like that. Because if you're missing the mark, you're missing the mark, and you're not going to get what you want. So it doesn't have to be difficult, but it does have to be accurate. So give me a call, give me a shout out, or call me, email me, and we'll set up time to visit and talk about your retention factor, or any of the A or B, or which one you should concentrate on more. So please do that. It's at edsharp333@gmail.com. More than happy to talk to you, see if we can help you improve your retention factor. Or maybe you're good with that and we go, okay, you need more new ones. So work on that, calculate that, look at your retention, see if you feel like you're retaining your patients, if you're getting them through the services that you want them to get because they need them. If you're not doing that, we have an issue there. So that needs to be addressed, and that's the B area. Now the C, which we'll talk to about in the next video, C is more cash services. So C is more services. All right, so more cash services. We'll talk about that more in the next video. Now, I am offering my free ebook to anyone that wants some help. Here's the ad for it, here's the cover, what it looks like. So if you want more of a thriving practice, you can email me at edsharp333@gmail.com and request I send you the ebook. It's free. It's my gift to you, holiday gift. I hope you guys are doing well. Please rate or review this. And your next video, we're going to be talking about more services, cash services. I hope this is helping. So we covered the A, B. The next one is C. Have a good day. Bye.